Today, nurse can do a biopsy, nurse can do endoscopy, nurse can look into various things, and nurse can even prescribe medicines. You require 1 year's extra training, what's called nurse practitioner. We train our nurses for 6 months. I've got a training course. This girl will sit there, and when a patient comes, she will classify the patient. There are various types of patients. Now, what is important is 1% of patients, remember that, require Western, high-tech, modern medicine. Like for example, somebody has a heart attack, somebody is collapsed, somebody has a stroke, somebody has diabetic coma. They require high-tech quick fixes just to tide them over. For long-term case, diabetes doesn't get treated with Western medicine. But for a quick diabetic coma to come out, you require that. Somebody has a heart attack, to save him at that time, you require modern medicine. But long-term treatment of coronary artery disease can be any system. So what she does is she filters that 1% and sends it to the Western medical. The 99% remaining patients, 90% of them are called minor illness syndromes. You would just sit in a open hospital outpatient, large hospital outpatient, 90% of them are minor illness syndromes, only 4 diseases. Common cold, feverish cold, sore throat, flu-like illness. You in the MBBS class were not taught about these 4. I can take a bet. But you are taught about coronary arteries, the end arteries, whether their end arteries, whether their collaterals are there, whether they can communicate or not. What does it matter? Whether it's adenocarcinoma, anaplastic, metastatic, what does it matter? Every cancer is metastatic. It is already metastasized before you see it in an organ. 50% of the ductal carcinoma in situ is not cancer at all. 100% of the follicular cancers in the thyroid in young girls is not cancer at all. Half the so-called prostatic cancers are not cancer at all. These are all what are called incidentalomas. Incidentally you find it because you have got scanning. Scanning is a curse. We all didn't know. If you don't know scanning, you don't know you've got a cyst in the ovary. But when you go for a scanning, the doctor will say, there is a cyst in the ovary. Is there any woman without a cyst in the ovary? Just imagine the physiology. Every month a ovum comes out and it doesn't become a fetus. Sometimes it doesn't come out, it remains there. It becomes a cyst. But what does the scanner say? Don't worry, you have a scan, it's okay. As you are living, he'll say, but occasionally it can become a cancer. You are dead. Such ridiculous things we do because we go too far into it. Remember that? Today the new disease. Every girl who works in IT industry has got PCOD. And PCOD is polycystic ovarian disease. Then what is it? It is in the mind. You must be in the IT industry to know how difficult it is to be in the IT industry in India. Because you are meant to work for 3 persons. There is no time limit, not 9 to 5. And you've got to work so hard, all the time looking at the idiot box called the computer. You can't even look this way, that way. You have no exercise at all. For your information's sake, sitting for 1 hour, doing nothing, is more dangerous than smoking for the heart's health. Today, sitting is supposed to be more dangerous than smoking. And walking for 1 hour is probably the best tonic for your heart. But we don't tell people about this. And a lot of us think sitting is good. If you go to American IT industry, boys and girls don't sit, they stand and do it. And even standing, they can't stand still. There's a slow moving belt underneath. So if you don't move, you will fall down. So this is what we don't do. And we kill our children. Just tension. And then PCOD. One girl came to me about 10 years ago, PCOD. She was about 90 kilos. She was like a football. And not menstruating at all and things like that. So I told her and her obsessive mother, you want your daughter to be alright? She said, yes. Ask her to resign her job. She said, doctor, she's getting a lakh of rupees. I said, how many lakhs she has collected so far? And how many you have spent on doctors now? You collect all those lakhs and give it all to the corporate hospitals. Are you happy? This girl left her job and today she is a specimen of good health. She still has got a good job. She has almost got a lakh of rupees pay. But she has absolutely no problem. This is where we fail. So the nurse says, this is minor illness syndrome.